Good day, everyone. Let me use this opportunity to welcome us all into today's class session. I am Mr. Oyedino Joshua by name, and I will be our resource person that will be taking us through this course NSC 206 titled General and Cellular Pathology. So, before we proceed, I would like us to have an overview of what this course is all about. And this class session is divided into 30 weeks of teaching, which should be done via online module teaching like this. So I will also want us to be informed that today's class session is just going to be an introductory class, which is just equipped us with what you are expected to able to take home at the end of all the class session. Also, I will want to advise us to regularly check our Moodle profile and our portal to get updated on things or information that will be very useful to us. So without any further ado, let's delve into today's class session. Let me take us to the course content first. So we have general mechanisms. We have the pathogenesis of disease and the dynamic nature of disease as it evolves from its incipient stage to its full expression, the effect of disease on organs and distal part of the body, pathology and the nature of disease, chemistry of cell damage and the dying cell, inflammation and infection, inflammatory response and chemical mediators, immunity and cellular immune response, principles of repair and reorganization of cell structure, cancers and genetic diseases, progression and implication to nursing. So within the course content and at the end of this course and end of this class session, we are expected to be able to describe the basic cellular events that lead to disease, explain the processes such as inflammation, infection, necrosis, and many others, recognize the presenting cellular and physiological signs of diseases such as cancers and certain genetic disorders, and discuss the progression and effects of cellular pathologies. So, introduction. Let me just quickly take us through what the pathology means. So, pathology is the study of disease, including its causes, progression, and effect. In other words, pathology is the study of the abnormalities of the cells or the tissues and the organs, which include what caused that abnormalities and how these abnormalities progress from its incipient, that is from its initial or from when it is initiated or when it started, and to when it started to take an effect on the patient or the victim. So the cellular pathology focuses on the changes that occur within the cell due to disease. Diseases arise from cellular injury response to infectious and abnormal growth or repair processes. So let's look at the basic cellular events leading to disease. So we have cellular injury, which usually occurs due to various stressors, toxins, and lack of nutrients. So we also have what we call the necrosis, which is the cell death due to injury leading to tissue damage. So we have what we also call the apoptosis, which is this is the programmed cell death, normal but can be abnormal in diseases like cancer. So we also have what we call the cellular adaptation, which uses the cells adapt to stress. So we have by something like aplasia, atrophy, or metaplasia. So let's talk about the necrosis and apoptosis. Necrosis is the pathological cell death due to external injuries such as toxins, trauma, which usually leads to inflammation and damage to surrounding tissues. So this is a diagram representation of cell injury, cell suicide, necrosis, and apoptosis. So as I said earlier, this class session is supposed to be, or is just an introductory class to equip us with what we are going to learn and to get familiarized with what we are expected to learn at the end of this class or the class sessions. So let me take us through the inflammation and infection. So what is inflammation? Inflammation is the body's defensive response to injury or infection characterized by redness, swelling, and heat. So we have what we call there are different types of inflammation. We have acute inflammation, we have chronic inflammation, which are rapid, in which the acute inflammation is a rapid and early response, often caused by trauma or infection, while the chronic inflammation is what is the prolonged inflammation leading to tissue damage and scarring. So, and why the infection, we will talk about inflammation, why the infection are caused when harmful microorganisms invade the body, in which they trigger the immune responses. So I hope you now get the clarity between the inflammation and infection. All right, so let me move on. So this is a diagram representation of inflammation and infection. This is caused by inflammation. This is caused by this is also called by inflammation. This is a redness. This is a redness of the skin. It is swelling. You can see it. This is caused by it, and this inflammation can also be caused by pain. So let's move on. Let me quickly take us through the immunity and cellular immune response. So we have different kind of immunity, but majorly two types, which is innate immunity and adaptive immunity. Also, we have what we call the cellular immune response, and that a particular there is a particular type of cell that helps to recognize infected cells. So, and such type of cell is called what? T cells. So let's quickly look at the principle of repair and cell structure reorganization. So when this cellular repair involves regeneration of tissues or replacement by scar tissues. So cells capable of rapid division, which include skin cells, regenerate faster. So also let's look at the reorganization of cell structure, which involves reestablishing normal cell structure after injury. So let me also take us through the cancers and genetic diseases. So I know that you've been hearing cancer, and today won't be the first day we hear about this. So, but let me just still give us a or an overview of what cancer is. So cancer is just is an uncontrolled growth and spread of abnormal cells. That is, those cells that have resulted into abnormal cells. So when they continue to grow and they become uncontrolled, and this is essentially caused by mutation in genes regulating cell division. So the cancers can be, when you say cancer can be benign, that is it means can be non-cancerous, or the cells or the cell can be what? Malignant, which is cancerous. When we say cells can be benign, which means it is not cancerous. So we also have the what we call the genetic disorders, and what leads to genetic diseases. So most of the genetic disorders are inherited conditions, or it's even it is the inherited conditions caused by mutations in genes affecting cellular function, e.g. cystic fibrosis and Down syndrome. I hope you can see the diagram representation beside it. So let me also take us to the progression and effect of cellular pathologies. So this you are going to be talking about how diseases progress from the incipient stages to full expression, which cause the organ and systemic damage. So also we'll also be looking at the effect on organs, that is the cellular pathologies which can cause organ failure, reduce functionality, and systemic effects. Example, chronic inflammation in the liver, which can lead to fibrosis and cirrhosis. So let me also take us to the pathogenesis of disease. And what this means is just refers to the origin and development of diseases. That is what exactly led to the diseases. What happened? How does this even come to being? So it includes the initial cause, that is cellular responses, and progression to full-blown or full-grown disease. So also I'll be taking us through the chemical mediators of of inflammation. That is, what are the chemicals that help to regulate and propagate inflammation? So we have chemicals like the histamine and prostaglandins. So histamine helps to increase blood vessel permeability, while the prostaglandins mediate pain and inflammation. So these mediators are released by immune cells and are affected uh, by blood vessels. So let me also take us through the repair and healing process. So the tissue repair, which involves regeneration of cells and the formation of scar tissue, which we call the process fibrosis. So this is how whenever there is an injury caused to the tissue, it undergo fibrosis to regenerate those cells that are being damaged or that have resulted into abnormalities. Um, so we'll talk about this in detail during our next class, or we'll start to discuss this week by week. So in conclusion, uh, I hope you agree with that cellular pathology provides insight into the fundamental mechanisms of disease, and understanding inflammation, infection, necrosis, and cancer helps in diagnosing and treating various conditions. And the progression and effect of disease are key to comprehending what the dynamic nature of pathology. So I hope that we've been able to pick one or two during this class, and we can relate and we can familiarize ourselves with some topics, even if not all. So what I would just want you to do for me is that at the or let me just say, when you are done with this class, I want you to go through the video again, and I will be sharing the resource material in which you can read, and I will want you to assimilate and take your time to read this resource material. So during the next class, any questions you have or more of the questions you have, you can bombard me with this question. I'm ready for you, and I will be happy to answer your questions. And thank you very much for staying with me to the end of the class. See you next class.